Anderson Cooper 360. Tomorrow night at 8 Eastern on CNN.
We want to turn now back to Robin Williams' death because it has put a spotlight on suicide. The CDC reports that that is the 10th leading cause of death in the United States. And research shows that suicides go up after a high-profile celebrity kills themselves. So is suicide somehow contagious? Joining us to discuss this is Dr. Judy Ho. She's a clinical and forensic psychologist, Dr. Charles Sophie, and Terry Williams, a mental health activist and author of Black Pain, It Just Looks Like We're Not Hurting. So glad to have all of you here for such an important issue tonight. Dr. Sophie, I want to start with you. Is suicide contagious?
Absolutely. There are studies that will support that the more glamorous it looks, or the more dramatic it looks, or the more that it looks like a place to find relief from the pain, the higher the rate of copycat suicides or contagiousness.
And we're going to talk about how we can avoid that, because there are steps that the media can take to make sure that it isn't this kind of contagion. But Terry, I want to talk about your personal story. You've dedicated yourself to destigmatizing depression and to being able to talk about suicidal thoughts. What was your reaction when you heard about what happened with Robin Williams?
Well, unfortunately, I wasn't surprised. As we move through this life, we know that people do wear masks, and we know that people feel hopeless and in despair. And I'm not surprised, because I think that people try to look for a way out, to have some kind of peace in their lives, you know? And I just think that I just wasn't surprised. I'm not really surprised, because I know that people, and especially people who are in entertainment, like Robin was, you know, you play the clown, always making people laugh, and many times it's the tears that we most experience.
Dr. Ho, we want to talk about this issue to increase awareness, but we obviously don't want to talk about it in such a way that it makes it seem to people who are suffering with severe depression that this is an okay outcome. So what is that balance for the media?
What a great question. And I think obviously there has been a lot of support on social media for these continued conversations, but there's also been backlash about, are we actually in some way, by talking about it and bringing so much attention to it, making this seem like it's an okay way to solve a problem when you're depressed? And I think the best thing that we can do is actually normalize the experience of depression and try to destigmatize it as much as possible by presenting it as the disorder that it is, which is a brain disorder. This is not something that is a matter of willpower, that somebody, when they're depressed, can just get themselves out of it and will themselves to get up in the morning and get on with their lives. People do need treatment. Unfortunately, 80% of people who suffer from depression don't get treatment, but conversely, 70 to 90% of people who go through cognitive behavioral therapy or medication treatment do get better from depression. So there is so much hope and a way for us to prevent it to getting to this very, very severe place of suicide.
That's such a great message, and I'm so glad that you made that message tonight. And I want to just bring up one more thing, Terry, about what the Academy of Motion Pictures tweeted that got a lot of backlash on social media, and that is, "Jeannie, you're free." And obviously people have said that's not the right message to send after a high-profile suicide. What do you think?
I think that it was in poor taste. I understand that the sentiment was that he had suffered so greatly that he was truly at peace, that there was no more suffering. But I did feel that it was in poor taste, you know?
And Dr. I'm sorry, go ahead.
No, you go ahead.
I'm just wondering, because as Allison so rightly brought up social media and talking about this tweet, you know, at first I said, well, of course, talking about it, it's always better to have more knowledge. But then you think about how fast things get around on social media, and it can really affect people, quite, you know, a few more people than in the past. What is the role that social media plays, and how is it more detrimental, you think? Dr. Sophie?
Well, I think it's very important that the messaging And that tool of messaging is done in a very clear and simple way, because people that are looking for the help, that are depressed or feel suicidal, do not have the ability to funnel through information and find numbers. Make it simple, make it clear, and make it unmixed, because many mixed messages come in it, and it's not a glamorized situation. Get the help, simple numbers, reach for help, and have resources, because the follow-up care is really the issue. It's okay and it's easy oftentimes to get a crisis intervention, but it's that aftercare where things fall off because of insurance or lack of resources.
Dr. Ho, here's something fascinating. When Marilyn Monroe killed herself, one study that looked at this suggested that suicides across the country went up by 12%. But that did not happen when Kurt Cobain, the beloved lead singer of Nirvana, when he killed himself. And the reason experts believe is because the Seattle authorities and media handled it differently than they did in, say, Marilyn Monroe or other people's case. And here's what the recommendations from the Suicide Prevention Foundation say. Number one, here's what the media should do. Avoid describing the suicide as some kind of escape from pain. Dr. Ho, why is that important?
Well, because it's sending this message that somehow this is the way that you problem solve your way out of a situation. And in fact, there's so many ways to problem solve yourself out of depression. We know these effective methods. They've been used for decades, and we know that they work. Unfortunately, that's not the message that gets across when people look at a suicide that has been very, very public, because all they think about is, wow, from the outside, this person's life looked great. So if they have nothing to live for, then what do I have to live for? And I think one of the things that we really have to caution is, to Dr. Sophie's point of the importance of follow-up care, oftentimes the research shows that suicides are actually more likely to happen as the individual is on an upswing from a very severe episode, because that's when they start to have the motivation and the willpower to actually take the active steps to carry out a suicide. So as morbid as that sounds, that is what the statistics say, and it's actually one of the most dangerous times when somebody doesn't have that adequate follow-up that's continued as they start to get better.
Let me just say a couple of more points that we should mention. Avoid graphic details of the method. That makes sense. Include message about prevention and treatment. We're certainly trying to do that, to get the message out there that there are other alternatives. And this is an important one, certainly, Terry. Include discussion of the pain that it causes to loved ones.
Well, yes, it does actually really have a profound impact on the loved ones. And I think what's important to keep in mind is that somewhere, somehow, the person who decided to die by suicide is, on some levels, is really at peace. You know, it's most difficult for those who are left behind. But that's what I thought when I first heard about Robin's death.
Yeah.
And I just think that we really have soul searching to do. We have to make sure that people do not feel as if the loved ones do not feel that in any way it was their fault.
Yes.
And I think that we need to share with young people whenever there is a visible, very visible suicide in the way that Robin was, is that he did the best that he could.
Yeah.
He did the very, very best that he could, and is to be loved and cherished still.
That's an excellent message. Dr. Ho, Dr. Sophie, Terry Williams, I want to say one more time what the suicide prevention hotline is. It's 1-800-275-8255. I will tweet that out, and there it is on the screen in case you missed my reading it. Thanks so much for talking about all of this with us.
It's important to talk about it, but to do it
in the right way.
In the right way, because I didn't believe that suicide. So I thought if you were at that point, then whatever, you were going to find a way to do it, or you weren't. But
research shows otherwise.
Research shows otherwise. Yeah. All right. A sad anniversary for an American held captive